Hello everyone, I'm Michael Jones, president of the Medical Exercise Training Institute, and we're back here again for our sixth tip in our Medical Exercise Training 101 ebook series. Now, these tips, and I guess I probably shouldn't use the word tips, but these thoughts and guidelines are based on what we've learned from our medical exercise specialists over the last 28 years. These 101 tips were actually questions that were asked of us, focused in on just simply one thing: building the medical exercise training practice, which means putting in systems, managing clients, as well as developing referral relationships with medical professionals, and probably most importantly, how to manage the practice so that you're profitable. So we're going to continue on. This is step number 6. And please, if you don't have a copy of the book, either look down below on this page or go over to met101ebook.com. The ebook is 100% free. Please download it. And if you don't mind, I'm going to go on to step number 6 or tip number 6. How do I explain medical exercise training to my clients? Because I know some of you are personal trainers and now you're making the transition. You've got to now explain this stuff. You may be charging a little bit more for it, so you got to explain what the difference is between what you're doing now and what you're doing then, what you did then. So here we go. Well, this is certainly a challenge. Having a clear and concise definition of medical exercise training is great, but some clients will still misunderstand and refer to you as either a physical therapist or a personal trainer. Now, those folks coming out of physical therapy, you're going to do some of the same exercises the therapist did. They're going to think you're a therapist. For those of you that have worked in gym settings or you have a personal training clientele and now you're doing more medical exercise with the client, the exercise look exactly the same. No one has a monopoly on exercise. Exercise is just exercise. This is where it becomes important to explain what medical exercise training is. The explanation I recommend is, as a medical exercise professional, I provide exercise services after you're discharged from physical therapy, chiropractic, or medical care. I specialize in exercise programming for clients with musculoskeletal, cardiovascular, neurologic, or metabolic disorders. I will communicate with your doctor, therapist, or chiropractor to ensure the exercise program will improve your function and not further exacerbate your condition. Exercise is the key to improving your level of function and managing your condition long term. My job is to improve your function through exercise. Folks, it's right here in the book. Please take this verbatim and use it. Even with the explanation, some people won't get it, especially in some instances, physicians. They won't get it. They don't understand exercise and they don't understand the differentiation between exercise used in a physical therapy setting and exercise used in a fitness setting. Exercise is exercise. It's just the presentation as to how the exercise is being used in its context. So for many years in the medical community, exercise was and still is associated with physical therapists. Physicians will automatically think if you're providing exercise for medical conditions, then you're a physical therapist. And some clients will too. Be prepared with the elevator speech I just gave you. I've noted above, when you meet medical professionals, especially physicians, or even new clients, immediately define your role and scope. If you don't, you leave your services open to misinterpretation. Folks, one thing my mama used to tell me was always make sure you define who you are so other people don't define who you are and then they put you in the wrong category. Medical exercise training is still in its infancy. Even though we're at 28 years, folks, this is still in its infancy compared to other professions. So you have to define it or you will be defined. Vitally important. And anytime you leave room for misinterpretation, that doesn't lead to a good outcome. So folks, it's important you define what medical exercise training is. All of you should have that elevator speech. I'm a medical exercise professional. I develop safe and effective protocol-based exercise for clients with medical conditions after they're discharged from physical therapy, chiropractic, or other medical services. I do not provide any aspect of medical treatment nor any diagnosis or diagnostic services. I just simply provide exercise to improve the client's functional capabilities. That becomes important. And I think as we're seeing this proliferation of medical exercise and medical fitness certifications, we're starting to blur the line between, are we medical professionals? Are we providing treatment or therapy? Or are we providing a higher level of exercise with a higher level of assessment and we're providing those services, and they're becoming more and more vital. Don't get caught up in this idea that I'm providing treatment. I'm a therapist, and I have to be honest with you, there are a lot of people out there using the term exercise therapist and fitness therapist, and we need to put those in check, because there are statutes out there or laws out there in many states that specifically govern who can use the term therapist and how that is laid out there to the community. So thanks for watching. Please join us again for tip number 7. Again, down below, download the ebook, or if you're not on our site, go to met101ebook.com. And please also make sure that you request the announcements, because we're going to do these every 3 or 4 days. We'd like for you to continue to get them. And these are all found in our MedX Pro Network. Go to medxpronetwork.com to get more information. Thanks again, and I appreciate your time and effort in watching this video. Take care.